Okay, so this is part 2, which is how acupuncture influences this system, our system, the human body, in order to modulate pain and have other effects, essentially. So, when you put a needle into the body, I've just popped in large intestine 4, I've just tidied up the video from last time because it got a bit messy. So, when you put a needle in locally, say large intestine 4, what happens locally? It has a very similar to reaction to as if you have an injury. So the body picks up that you have got a localised trauma. Obviously, a tiny 0.2mm needle isn't going to create massive amounts of trauma. So you're not going to have the physical damage, but you are stimulating mechanoreceptors and everything in the area, which will stimulate a reaction. So you will get a release of CGRP, bradykinins, prostaglandins, substance P and histamine. Okay, obviously less than if you have an actually proper injury, but there is going to be a release of it. And also, the more you stimulate that needle, the greater reaction will be. So depending on what you want to do in the area will kind of influence how much you want to manipulate that needle. If you're putting that needle into an area of tissue which is unhealthy, poor blood supply, a poorly healed area, like a stage 2 or 3 tendinopathy, for example, you might want to put that needle in and stimulate it quite strongly because you want to release off lots of CGRP, which helps with repair. Bradykinin opens up the blood vessels, gets new blood vessel growth, so what we call angiogenesis, so more blood vessel growth, which is a problem in things like chronic tendinopathies, okay? Obviously, you are going to get a little bit of substance P, histamine, so there might be a little bit of localised tenderness with the needle, but it's normally much more modulated than if you've smacked someone with a hammer, for example. However, if someone has acutely or recently had an injury, or they're very peripherally sensitised and they have lots of substance P, histamine, prostaglandins, which create pain and inflammation in the area, and you put a needle in and elevate it even further, they are not going to like you much. So essentially what I'm saying is don't needle an acutely injured or very strongly peripherally sensitised area because you will have no more benefit to it. Locally, you're going to have a very adverse reaction to that needle. So stay away from those areas with needles. But if it's a poorly healed area, bring the needles. The more the merrier sometimes, to a degree. So, local effects of needling. We're going to move on to segmental effects of needling. So how can this all be manipulated here? So again, like I said, the body views it as almost like a little injury. It sends a signal to your dorsal horn and stimulates the release of GABA from the interhorn. So that can help stimulate a inhibition of signal, which goes across from the exterior to the central nervous system of the spinal cord. Cord. So there can be an inhibitory effect. Again, if someone is massively centrally sensitised there, they've got lots of substance P already acting on it, you could make that area worse. Sometimes the GABA response is actually been in very chronic conditions like extreme fibromyalgia, where the chronic pain is at a very high level. You've again got to be careful with overstimulating that area, because sometimes this release mechanism has diminished to a degree that it's really not working. So it's quite hard to stimulate with a needle, and all you're going to do is encourage a bit more substance P. So it's balance. But putting a needle on in the local area will stimulate a signal through the A delta, A beta, C fibres, which on the whole for most people will release off GABA to give you that segmental effect. And that actually occurs quite quickly. So think about your dermatomes, because that's what you're going to be working on. So for example, C4 dermatome, as you can see this bit on me, if you put it in at C4 level, after a few minutes, actually you'll notice that the pain in that area, even just palpations, the pain pressure threshold will already be improved. So that is if you put a needle within the segment, so anywhere within that C4 dermatome. So it could be somewhere in here where the pain may be. You could use the other side. So if, for example, you've got an acute injury on one side, don't want to put a needle in because of all the local effects that I'm going to stimulate, I could put a needle in the other side, and that will still stimulate a segmental inhibition of pain through GABA, and then you will reduce the pain fairly quickly, and then you can get them to move the arm or kind of do a bit of local manipulation work without stimulating a huge pain response. So you get a segmental effect. The other thing it does is it will start to stimulate this response as well. So the periaqueductal grey and the nucleus raphe magnus will start to release off a little bit of serotonin. And that serotonin feeds back down, again inhibiting that signal across from the peripheral nervous system to the central nervous system of the spinal cord. So again, you get that control there. So again, acupuncture will reduce that signalling going up. So the pain, or the signal, is going from the dorsal horn to anterior horn and up the spinothalamic tract to the thalamus. Okay, so far we've had local modulation, we've had segmental modulation, and now we're going for the supraspinal areas. So again, how does this area get modulated? By acupuncture. Acupuncture needles have a massive effect, if done in the right way, on the central nervous system. And if you think about, if you want a bigger effect in the brain, you want a bigger effect on the somatosensory cortex, essentially, you will go to areas that are more richly innervated. So if you think more sensitive areas, hands, very sensitive, feet are more sensitive. If you step on a Lego, you know about it. Someone told me lips and mouth are very innervated. Please don't needle in those areas. But yeah, hands and feet will have a stronger, on the whole, supraspinal effect than maybe a point in the back where your sensory kind of perception is less. Okay, so we're thinking distal points. Acupuncture, we know from functional MRIs, we know from scans that acupuncture has a massive effect on this. So lots of scans on the hypothalamus will say that putting a needle in some of these points will modulate the signals going through these areas. So they modulate the effects and responses of parts of the brain to pain, stress, memories, all of that. Anything that inputs, it can help modulate. Okay, so the hypothalamus being one of the big ones it researches. Like we said, it sends signals to your limbic system, so fears, emotions, behaviour, learning. We're talking about things like brain fog. We're talking about things that set off the stress reaction, for example, can be modulated. Big one is our stress response. So think of the autonomic nervous system and the pituitary. So this signal from and to the hypothalamus to the autonomic nervous system, for example. These two to communicate, and we know again that the autonomic nervous system is massively affected by acupuncture. Chinese medicine will, refers to the effects that it has in this respect. It's very much reflected in their terms yin and yang. Yin being reflected in parasympathetic, yang being reflected in sympathetic nervous system. We know when you put an acupuncture needle into the body, the more you stimulate it, the more you will affect the sympathetic nervous system. So you'll get a spike in sympathetic activity. Okay, remember sympathetic is things like heart rate, pro-inflammatory, more your stress response things, blood pressure, muscle tension, releasing off glucose, sugar, kind of freeing up metabolism. So when you put a needle in, you will stimulate someone's sympathetic nervous system. The more you stimulate it, kind of the more you get an overall sympathetic response. That's kind of getting Tai Chi. When you leave the needle in after you've stimulated it, the sympathetic response tends to kind of diminish a bit, and you get a overall parasympathetic increase in activity. So you become more rested, digested. So your kind of digestion system, your immune response, your ability to switch off, all of these things will start to be more stimulated, regulated, and hopefully improve. So by the end of the treatment, most people are super relaxed because we've had an overall parasympathetic response through a bit of sympathetic stimulation and then a massive parasympathetic response, which by the end is hopefully, generally with a lot of people, what you're after. Now just remember, if someone comes in with a massively high sympathetic drive, very stressed, very sensitised, heart rate massively wild, you can tell sympathetically driven people. Look it up. And you start putting a needle in and massively stimulating it, again, you are going to increase their drive even further to a point where they will not tolerate needling. So do not use sensitive points, do not use massive stimulation. modulate how you needle. Either don't use needles to begin with, just do something to do with the parasympathetic side. So you can use auricular stimulation because it's supplied by the vagus nerve, which is parasympathetic. You could do some acupressure. You could use a TENS machine over the points, or if you are going to needle kind of not less sensitive points, so maybe not hands and feet straight away, and needle very, very gently. So put the needle in and don't even think about Tai Chi. If they're really sensitised, you start putting needles in, they will not tolerate it. So again, manipulate your needling according to what state your patient, your client comes in. So that's this system. Okay, the hypothalamus also is stimulated by the needles to send signals to the pituitary gland. Like I said, massive control of hormones. So this also sends signals to your gonads, your ovaries in women, testes in men, to stimulate things like in women, follicle stimulating hormone, estrogen, progesterone, all of those things, and gonads, testosterone. Also stimulates the release of oxytocin, which is massively important in many things, functions in the body. There's a lot in the women's health role, so things like falling pregnant, inducing like labour. Oxytocin converts to prostaglandins, which starts off contractions. It can stimulate the maternal link with the baby. It kind of stimulates ethnocentric behaviour, so kind of identifying people that we feel familiar to and creating a link. All these types of emotional reactions link with oxytocin, which comes under hypothalamus control ultimately. And as we said, the pituitary sends a signal to your adrenal gland, which releases off cortisol, and cortisol is massively important for energy. So in the morning when you wake up, your cortisol levels rise, so you actually wake up with a bit of energy. They dip during the day and are at their lowest during the night time, so you can sleep. You don't need to metabolise massively at night. Cortisol also, like I said, has a massive anti-inflammatory effect. So if you've got lots of injuries in the body, you will need to have cortisol to keep that inflammation modulated to a normal level. Which is probably why inflammation hurts worse at night, because your cortisol levels are lowest at night time. So this circadian rhythm of cortisol, high during the day, low during the night, is very, very important. And things like chronic fatigue syndrome, lots of fibromyalgia clients, they have this very flattened levels of cortisol, which is why they have such poor inflammatory control, very high pain levels, and also their energy levels are quite often, well, chronic fatigue syndrome, it kind of talks for itself really. So all of these are affected supraspinal effects of acupuncture, and as we said, all of this ultimately feeds back to the thalamus and essentially stimulates a pain signal, okay, or it can manipulate whatever pain signals are in the body, therefore influencing this whole process and things that you perceive at the end of it. So local effects, segmental effects, supraspinal effects of acupuncture.